What if stomach cancer is silently growing inside you right now, and you have no idea? Most people don't notice the warning signs until it's too late. But today, I'm going to reveal 10 early symptoms that could save your life. Because the truth is, stomach cancer often starts with mild, everyday discomforts that people ignore. Could you be missing the signs? Stay with me, because if you experience even 2 of these symptoms, it might be time to take action. Let's start with the first one. Persistent bloating, feeling unusually full or swollen after eating, even small meals, is a symptom many people brush off as normal. However, persistent bloating that lasts for weeks could be a sign of something more serious. In stomach cancer, a tumor can block the digestive tract, causing food and gas to build up in the stomach. This can lead to a constant feeling of fullness or pressure in your abdomen. While bloating is common and often harmless, if it doesn't go away or worsens over time, it's a hidden warning sign you shouldn't ignore. But bloating isn't the only subtle symptom. Let's talk about indigestion next. Occasional heartburn or indigestion is normal, especially after a heavy meal. But if you're experiencing constant burning or discomfort in your chest or stomach that doesn't improve with over-the-counter medications, it could be a red flag. Chronic indigestion might indicate irritation or damage to your stomach lining, possibly caused by a tumor. If you've had heartburn for weeks or months, it's more than just acid reflux. It's a sign your body is struggling, and you should get it checked out. Now, let's move on to another symptom that's easy to overlook: nausea. Feeling queasy, especially after eating, even when you're not sick, is a subtle but important symptom. Persistent nausea might mean your stomach isn't functioning properly, possibly due to a tumor interfering with digestion. While nausea can have many causes, such as stress or a stomach bug, ongoing discomfort after meals is a red flag. If you're frequently feeling nauseous without an obvious reason, it's worth investigating further. Next, let's discuss a symptom that can sneak up on you: loss of appetite. Suddenly finding food unappealing or feeling full too quickly isn't just a passing phase, it could be a sign of a deeper issue. In stomach cancer, a tumor can disrupt the hormones and signals that control hunger, making you eat less without realizing it. Over time, this can lead to malnutrition and weight loss, further weakening your body. If you've lost interest in food or feel full after just a few bites, it's a symptom you shouldn't overlook. Speaking of weight loss, let's talk about unexplained fatigue, which often goes hand in hand. Feeling exhausted all the time, even after a good night's sleep, is a common but often overlooked symptom. Fatigue can result from your body fighting cancer or losing nutrients due to poor digestion. Cancer cells consume a lot of energy, leaving you feeling drained and weak. If you're constantly tired without a clear reason, it's a sign something deeper might be wrong. Don't dismiss it as just being busy or stressed. Your body could be sending you a warning. Now, let's move on to a more noticeable symptom: stomach pain. Constant, dull ache in your upper abdomen that doesn't go away is a symptom you should never ignore. This pain could mean the cancer is growing or pressing on nearby organs, causing discomfort. While stomach pain can have many causes, such as ulcers or gastritis, persistent or worsening pain is a red flag. If the pain is new, unusual, or doesn't respond to typical treatments, it's time to see a doctor. Next, let's talk about a symptom that can make eating difficult: trouble swallowing. Feeling like food gets stuck in your throat or chest is a serious warning sign. Tumors near the esophagus can block food from passing through, making swallowing painful or uncomfortable. This condition, known as dysphagia, can lead to choking, weight loss, and dehydration. If you're struggling to eat or drink, it's a clear sign you need medical attention. Don't wait. This symptom can worsen quickly and may indicate advanced disease. Now, let's discuss a symptom that's impossible to ignore: vomiting, sometimes with blood. Throwing up, especially if there's blood, is a clear signal something's wrong. Blood and vomit, which may look like coffee grounds, can indicate bleeding in the stomach lining, often caused by a tumor. Vomiting that persists or includes blood is a medical emergency and requires immediate evaluation. Even if the blood is minimal, it's a sign of a potentially life-threatening problem that needs urgent attention. Next, let's talk about a symptom that often accompanies vomiting: unexplained weight loss. Losing weight without dieting or exercise is a major red flag. Cancer often causes weight loss by disrupting metabolism and appetite. If you've lost 10 pounds or more without trying, it's time to see a doctor. Unexplained weight loss can be a sign of many serious conditions, including stomach cancer. Your body could be under stress, and early detection is key to improving outcomes. Finally, let's discuss a symptom that's a clear sign of internal bleeding: black, tarry stools. Dark, sticky stools can indicate internal bleeding, a serious symptom of stomach cancer. This happens when blood mixes with digestive fluids, turning the stool black and tar-like. It's often a sign of bleeding in the upper digestive tract, possibly caused by a tumor. If you notice this, seek medical help immediately. It's a sign of a potentially life-threatening problem. Don't wait. Early intervention can make all the difference. Now that you know these 10 red flags, let's talk about who's most at risk and what you should do next. Are you at higher risk for stomach cancer? Here's what you need to know. Certain factors increase your risk: a diet high in smoked, salted, or processed foods, smoking or heavy alcohol use, a family history of stomach cancer, or a chronic H. pylori infection. These can damage your stomach lining or cause long-term inflammation. But even if you have these risks, catching symptoms early can make a huge difference. Knowing your risk helps you stay vigilant and take action to protect your health. What should you do if you're experiencing these symptoms? Don't panic, but don't ignore them either. Start by writing down your symptoms and how long you've had them. This will help your doctor understand your situation better. Then, schedule an appointment as soon as possible. Early diagnosis saves lives. Remember, it's better to be safe than sorry. Taking action now could make all the difference. Stomach cancer is a silent killer, but catching it early can save lives. By recognizing these 10 hidden red flags, you could protect yourself or someone you love. Early detection boosts survival rates by up to 90%, so don't wait. If this video helped you, share it with friends and family. You never know whose life you might save.